Koate Vial is a medication used to control and prevent bleeding episodes in individuals with low levels of factor VIII, hemophilia A. It is also used before surgery to prevent bleeding in these patients. Low factor VIII levels can lead to prolonged bleeding after an injury or surgery, as well as bleeding inside the body, especially in the joints and muscles. This product contains human factor VIII, also known as antihemophilic factor, and is used to temporarily replace the missing factor VIII protein in the blood, allowing the blood to clot and stop the bleeding. The daily dosage and optimal timing for taking this medication should be determined by a healthcare professional. When using Koate Vial, the medication is given by injection into a vein, usually over 5 to 10 minutes. Depending on your dose and how you respond to it, the medication may need to be given more slowly over a longer time. After receiving the medication in a hemophilia treatment center or hospital, some patients may be able to give it to themselves at home. If directed to do so by your doctor, it's important to read the product information available from your pharmacist before you start using it and each time you get a refill. Make sure to learn all preparation and usage instructions in the product package. If you have any questions, ask your healthcare professional. Before combining the solution used to mix the medication, make sure that both the medication and the solution have been brought to room temperature if they have been refrigerated. After adding the solution to the powder, some brands of this medication may require you to shake the vial for 10 to 15 seconds before gently swirling the vial to completely dissolve the powder. Other brands do not recommend shaking the vial. Ask your pharmacist about the proper way to mix your medication. Before using this product, check it visually for particles or discoloration. If either is present, do not use the liquid. Use right away. The dosage is based on your medical condition, weight, blood test results, and response to treatment. It is important to follow your doctor's instructions closely and ask your doctor or pharmacist if you have any questions. Learn how to store and discard needles and medical supplies safely, and consult your pharmacist. If your condition does not improve or if it worsens, make sure to tell your doctor. Some common side effects of Koate Vial may include flushing of the face, nausea, vomiting, and fast heartbeat, which can be lessened by giving the medication more slowly. You may also experience burning, redness, or irritation at the injection site, fever, chills, and headache. If these effects persist or worsen, it's important to inform your doctor or pharmacist promptly. It's important to remember that this medication has been prescribed because your doctor has determined that the benefits outweigh the potential side effects. Many people using this medication do not experience serious side effects. However, it's crucial to contact your doctor immediately if you experience any serious side effects, such as signs of anemia, new or worsening bleeding or bruising. A serious allergic reaction to this drug is rare, but seek medical help right away if you notice symptoms such as rash, itching or swelling, severe dizziness, trouble breathing, or chest discomfort. This is not a complete list of possible side effects, so if you notice any other effects not mentioned here, it's important to contact your doctor or pharmacist. Before using Koate Vial, make sure to inform your doctor or pharmacist if you have any allergies to antihemophilic factor products, natural rubber/latex, or any other allergies. This medication may contain inactive ingredients that can cause allergic reactions, so it's important to discuss this with your pharmacist. It's important to also inform your doctor or pharmacist about your medical history before using Koate Vial. Some brands of this medication recommend monitoring your heartbeat during treatment. If your heart starts to beat faster, it is recommended to slow down the infusion or temporarily stop it until your heart rate returns to normal. It's important to consult your doctor for more details on this. Koate Vial is made from human blood, and although it is carefully tested and undergoes a special manufacturing process, there is a very small chance of getting infections from the medication, such as viruses like hepatitis. Consult your doctor or pharmacist for more information on this. If you are pregnant, Koate Vial should only be used when clearly needed. It's important to discuss the risks and benefits with your doctor before using this medication during pregnancy. It is not known if this drug passes into breast milk, so it's important to consult your doctor before breastfeeding while using Koate Vial. When taking Koate Vial, it's important to be aware of potential drug interactions that could affect how your medications work or increase your risk for serious side effects. To ensure safety, keep a list of all the products you use, including prescription/non-prescription drugs and herbal products, and share it with your doctor and pharmacist. Always consult your doctor before starting, stopping, or changing the dosage of any medicines while using Koate Vial. If someone has taken too much Koate Vial and is experiencing severe symptoms like fainting or difficulty breathing, it's important to seek medical help immediately. In the U.S., you can call your local poison control center at 1-800-222-1222, and in Canada, residents can call a provincial poison control center. It's important not to share this medication with others. Your doctor may also want to monitor your factor VIII levels through lab tests while you are using Koate Vial, so it's important to keep all medical and lab appointments. Be sure to consult your doctor for more details on this. Make sure to always follow the dosing schedule set by your doctor. If you happen to miss a dose, consult with your doctor or pharmacist immediately to create a new dosing schedule. Do not take a double dose to make up for the missed one. When using Koate Vial, it's important to store it according to the manufacturer's instructions. Some brands of this medication can only be kept at room temperature for a few months, so make sure to check with your pharmacist for more details. Avoid freezing the product and protect it from light. Once the liquid is mixed, do not refrigerate it and use it within 3 hours, unless the product instructions tell you otherwise. Any unused portion should be thrown away. Keep all medications out of reach of children and pets. It's important to properly dispose of this product and it is expired or no longer needed. Do not flush it down the toilet or pour it into a drain unless instructed to do so. Consult your pharmacist or local waste disposal company for the best way to discard it. If you need more help, call your doctor for medical advice. In the US, you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.